tiny piece of skin next to your nail. You know the one. It looks like nothing, just a small flap sticking out at the edge. And every single time, your brain says the same thing. Just pull it off. It'll take 2 seconds. So you do. And instantly, sharp pain shoots through your finger. Sometimes it bleeds. And you're standing there thinking, how does something that small hurt that? Here's what's actually going on. And honestly, most people have no idea. That little flap isn't part of your nail at all. It's a tiny piece of torn skin from the area around your nail, specifically connected to something called the cuticle. And to understand why it hurts so much, you need to know what the cuticle actually does. It's a thin seal of skin that sits right where your nail meets your finger. Its entire job is to act as a barrier, keeping bacteria, dirt, and moisture from sneaking underneath the nail where infections can quietly start. When that skin is healthy, you barely notice it's there. But when it dries out, cracks, or gets damaged, small pieces start to tear away from the surface. That's your hangnail. And because that little flap is still connected to living tissue underneath, tissue with nerves and blood vessels, pulling it doesn't just remove dead skin. You're tearing into living skin. That's why it stings, bleeds, and sometimes swells up from something that looks almost invisible. So why does this keep happening in the first place? The most common reason is simply dry skin. When the skin around your nails loses moisture, it becomes brittle and tears more easily. Cold weather makes this worse. So does washing your hands frequently, because soap strips away the natural oils, keep skin flexible and elastic. Without those oils, the skin gets tight, stiff, and eventually cracks. Then there's mechanical stress, things like biting your nails, picking at the edges, or even the small repetitive friction of everyday tasks. These micro injuries build up quietly. The skin weakens gradually, and eventually a hangnail forms. And in some cases, nutrition plays a role too. Deficiencies in B vitamins, iron, or protein can make both skin and nails more fragile. It's not the cause of every hangnail, but if you're dealing with them constantly alongside brittle nails and dry skin, it's worth paying attention to. Now here's where most people make things significantly worse without realizing it. The instinct when you spot a hangnail is to grab it and pull, but the skin is connected deeper than it looks. When you pull, the tear doesn't stop where you expect to. It rips into the surrounding tissue and creates a much larger wound than what you started with. That tiny flap suddenly becomes a painful, swollen red area around the nail. And once there's an open tear, bacteria have a way in. That can lead to something called paronychia, an infection where the skin around the nail becomes tender, warm, and sometimes fills with pus, all from a 2-second tug that felt completely harmless. The fix is actually much simpler than most people expect. Use clean nail clippers or small scissors and carefully trim the loose skin as close to the base as possible. You're removing the flap cleanly without tearing deeper layers. After that, apply a little moisturizer or petroleum jelly to keep the area soft while it heals. That's really it. And if you want to stop them from forming in the first place, the habits that matter most are straightforward. Moisturize your hands regularly, especially right after washing them. That's when skin loses the most hydration. Avoid biting your nails or picking at the cuticle. Trim your nails regularly so rough edges don't catch and pull on surrounding skin. And if you work with water, cleaning products, or alcohol-based sanitizers frequently, consider wearing gloves. The skin around your nails is losing moisture faster than you realize in those situations. But here's the part that actually makes this interesting beyond just hangnails. Your nails and the skin around them are surprisingly good at reflecting what's happening inside your body. Pale nails can sometimes be linked to anemia. A yellowish tint may appear with fungal infections. Vertical ridges often show up when nails are dry or aging. Those white spots people blame on calcium deficiency. Usually just minor trauma to the nail as it was growing. And when the cuticle area is constantly dry, inflamed, or tearing, it's often a sign that the skin barrier itself is struggling, either from environmental exposure, dehydration, or nutritional gap. The skin around your nails is one of the most exposed and least protected areas on your body, and it repairs itself quickly, which means the small habits you repeat every single day either strengthen it or slowly break it down. So the next time you notice that tiny flap of skin forming near your nail, don't pull it. Trim it, moisturize it, give it a moment, because that small signal is just your skin telling you it needs a little more care than it's been getting. And if you find it fascinating how much your body quietly communicates through these small details, what your nails, tongue, and skin are telling you that most people completely ignore, subscribe. That's exactly what this channel is about. Breaking down the small signals your body sends every day and turning them into something you can actually understand and act on. The next one might make you look at your own hands very differently.